The reason I make this assumption is because when young people drink, the likelihood of us drinking responsibly is unlikely because adolescents like you and me are impulsive. Sorry guys. We make decisions based on a risk-reward criteria. What's the point of drinking a little bit and not feeling the effects when I can drink a whole heap and have an absolute blast? While the short-term effects of excessive alcohol consumption can be fun, in the long term, binge drinking can lead to alcohol dependency, alcohol-related brain injury, cancers, cirrhosis and liver failure, concentration and long-term memory problems, heart and cerebrovascular diseases including hypertension and stroke, poor nutrition, problems with the nerves in the arms and legs, sexual and reproductive problems such as impotence and fertility, skin problems, stomach complaints and problems, family and relationship problems, poor work performance, legal and financial difficulties. Whilst binge drinking can lead to disease and illness, in the long term, some people neglect to consider other implications of excessive youth drinking, in particular addiction, academic performance, and fertility complications. Alcohol poses several risks to young people. As the adolescent brain is not yet fully developed, early exposure to alcohol can lead to permanent brain damage. Having poor concentration skills and a severely forgetful memory are just a few of these lifelong consequences of teenage binge drinking. As young people are still developing, the likelihood of young people blacking out or passing out is doubled. This means that there is a distinct increase in the vulnerability of young people. This means that young girls are at further risk of being sexually assaulted by several men, but are also more likely to participate in the consumption of other illicit drugs. Males are more likely to commit criminal offences because of the impulsive and rebellious stage of their brain development. Crimes such as robbery and vandalism are very common. However, the most common behaviour amongst young men is alcohol-fueled violence, which is very unfortunate. I conducted an interview with a good friend of mine, Alana, and she told me that she went to a few parties and there were boys who were angry before drinking and they drank and they were absolutely smashed. And they're out in the garden, they're just out there like just hitting. They don't actually hitting anybody, but they're just out there just having a couple of whacks just into the air, which if I was just standing here just punching around the place, I'd look pretty stupid, I'm pretty sure. Unless I was wearing some karate or taekwondo outfit. I think I'd look pretty ridiculous. She had also been involved in a drug-fueled altercation with people where she was not injured, but the boys that were involved had to be taken to the hospital for severe facial and body injuries. But I guess the sad thing about all this is, if you're a parent, could you imagine being called in the middle of the night and being told by the police that your child's in hospital and they're in a critical condition? Could you imagine how scary that would be? It is not fair on everybody involved, which is why it is better to abstain from alcohol as long as you possibly can. As I said previously, on several occasions our brains are still developing, making us vulnerable. Alcohol is particularly dangerous at this stage because teenagers are more susceptible to addiction, particularly if adolescents get wasted. When I say get wasted, I mean like absolutely smashed. At least once a week. The likelihood of alcohol dependence is significantly increased. With addiction comes a whole string of negative side effects. These include financial vulnerability due to the cost of purchasing alcohol, but also the deterioration of relationships. Ask yourself this very basic question. Would you really want to date an alcoholic? I mean, I know I sound very, discriminative when I say that, but when you consider all the all the long-term and short-term risks I previously listed, is it really worth the risk? This part is more the psychology part, which I found really interesting, and I know some people in here really like psychology, so I figured I'd just give you sort of a brief overview. Our brains are made up of different elements, and each element is responsible for different bodily functions. The main parts of the brain which are affected by alcohol in the frontal hemisphere are found in the frontal hemisphere. These parts include the cerebral cortex, the cerebellum, medulla, and hypothalamus in the limbic system, which is a combination of different parts of the brain. The cerebral cortex is responsible for several different bodily functions, namely sensory information, so blood, vision, dull hearing, that kind of stuff that you experience when you're drunk. And the cerebellum controls balance and coordination. When drunk, and whenever you're drunk, and I know when I was younger, very, very young, I went down Hanley Street. I know, unbelievable. But I went down Hanley Street, and there was this girl, and she was just dancing and stuff. And she was just dancing around, having a good time. And then she just fell on me. And I have to say, it wasn't actually the greatest moment of my life. Mainly because the girl was covered in vodka, and presumably not hers, which wasn't really fun for me. But bad stuff can happen. And I'm sure she was also intoxicated with other drugs, not just alcohol. The medulla controls unconscious bodily functions like breathing. When drunk, alcohol inhibits the part of the brain causing a change in heartbeat and body temperature. This also makes the drunk sleepy. The hypothalamus controls the hormones within the body and is responsible for the increase of dopamine within the brain when drinking, but also the increased production of testosterone and estrogen, causing increased sexual drive. So when you hear of drunk people having unprotected sex, this part of the brain is actually responsible for it. Finally, the limbic system is made up of the amygdala, hypothalamus, and hippocampus. When under the influence, the person's personality changes and causes mood swings and a sudden increase or decrease in confidence levels. When the limbic system is affected by alcohol, it's pretty safe to assume that you're voluntarily smashed. Now, I know we had the talk from Paul Dillon earlier in the year, so I won't go into too much detail about this. Sorry, Celia. But I'll just go over some key points which I think are really important to emphasise. If your friend is devastatingly drunk and you consider that they are going to be sick, try to take care of them before they pass out or throw up, just to ensure that they can sober up while awake. This makes it easier for you to care for them. The chair test invented by Paul Dillon, which he explained to us, is designed to see whether you need to call an ambulance for an extremely intoxicated friend. A 5-step summary of the process is sit the person down in a stable chair with solid back, no armrests. See if the person can support their head for longer than 5 seconds. Ask them a simple question. Are they speaking English? If the person is not capable of supporting their head, call an ambulance. If they can but are not speaking, give them a bottle of water and begin to sober them up. If a person is drunk and unconscious, call an ambulance immediately and position them straight away in the recovery position. So as you can see here, the hand's supposed to support the head so that you don't vomit, and knee just slightly over the body so that you don't roll into your stomach. And, yeah. Hopefully I can continue this tomorrow with you guys. So thank you.